Hello everyone, I'm Katie and I'm one of the hearing care assistants here at Audiology Associates.
And my name is Taylor Green and I'm the other audiologist here. And that's our 30-minute introduction.
I was going to say, let's just go on now. We've talked right over the back of the wall. First patient's mine's a long one, guys. Was just super dry wax. You can see these big, dry bits of skin right at the entrance to the canal. Narrow canal as well, which makes it a little bit more awkward. But you can see that.
Just a little bit.
Yeah, it's just a tad on the narrow side. But lots of skin and wax, and then more skin.
Touching the sides, eh?
I know, yeah.
But that is narrow, isn't it?
It's mega narrow.
They're the type of ones I would go, Reese,
Yeah.
we've got 10 minutes.
So I had one the other day and we had to get Tish, who's one of the ladies here on reception, she had to come in and hold the ear because it was just so collapsed. I just could not get the tool in. Oh, it was actually one of yours, wasn't it?
I think it was.
Yeah,
I think it was just lit because when I done the first otoscopy, obviously when you lift the ear back and I looked in, I was like, oh, okay, not too bad. Went in then, I was like, oh.
Yeah, like
Vision's
I
gone.
couldn't even get a fine ending because the cartilage was just the skin was collapsing around the tube. Yeah,
and it just kept like coming in with suction, didn't it? I remember you saying now.
Yeah, real difficult one to do. So with this one, we just got this sort of very, very dry skin, and that's peeling away, and then we've got this wax in the middle, which is just sitting in place, drying out here. So we talk about those like little bits of skin that will keep jumping up to the suction all the time. That's exactly what's happening here. I'm trying to get to the plug beyond it.
It's just a nightmare when it comes away bits, little bits.
Yeah, you want that nice big old plug to come away. But these last bits now are super dry as well.
A bit of oil would have helped with that.
It would.
That's the vision side of it as well, though,
yeah,
isn't it?
Because it's so narrow.
You've got to hold it open. It's a tricky one, isn't it?
Okay.
I try and that would be sort of like a real last resort if I was struggling a bit.
Right,
I'd pop the oil in there.
Because there might be a chance that it might not even reach where you're trying to get.
Yeah, that's true.
It's like a tunnel. It's never ending.
You know, it was so deep, and when they're this narrow, you really it's like caving. You don't even want. When it's that deep, it's just so difficult to remove.
It seemed to have gone a bit wider though.
Yeah.
It was just the outer portion was just narrow.
Yeah.
Okay.
It's kind of like where the cartilage
portion
is quite flexible. That area. This is like the bony area. The bony portion.
You can see the actual canal, how dry that is, can't you?
Ripples.
Yeah, it's always that kind of. It looks like ripples of a pond just running all the way down the canal. I know.
That's been in a while.
It's been in here a little while, but it's rock solid. But it is almost right down the drum, so we've got to be really careful with this. How we spin it.
Oh, because of the rough side, if it catches the drum.
Don't want that back end kind of scraping across the eardrum, which would be really uncomfortable for the patient. But we're going to have a problem because it's formed in that shape of that wider section of the canal. But bringing this down the canal now, it's going to hit that narrow entrance, which is what we got here. So this is where the forceps are coming in. I wouldn't normally use forceps on this type of wax.
No.
I didn't even work that time either.
Just pushed it in further.
Just pushed it in further. Pushed it all the way back down the road, just taking it away from.
Like, I can hear it. Oh no, I can't. Blocked up again.
It is frustrating when you do that though. You start to get the peel and the pull, and then you just do one little thing and it's just cool.
Yeah. It's when you're pulling out the anterior recess. Yeah. So that's always the one when you've got that tiny little bit, that ridge just catch hold of, and you go so far and you go to move it and do it, and the back end you've just spent ages upon, just flops back down where it was before. It's coming away nicely though.
Yeah, surprisingly.
Bit of a shimmy, but then a bit of a wiggle.
I know.
It looks like you're struggling to get a grip on the suction there.
Yeah, it's so dry.
Super dry, yeah.
No, because obviously of the dryness of that.
Yeah.
Would you kind of get the best grip then if you had like a flat? Because obviously when you're trying to get, you've got like a little gap of A. So you're not going to get the full grip then, is it? Yeah,
so a flatter one, or if the canal's a little bit wider, if you popped a bit of oil on it, it sort of sits on the surface and then can help you kind of get that grip. But because this is just so narrow and so dry, I'm just trying to reposition with the right hook. And try to turn it slightly so I can find somewhere to get a better grip.
It's just quite spiky, isn't it? You don't really get that grip because of those little bumps on the surface. But like I said, even if it was really dry, but it had a flat surface, you could have gripped that a lot better.
Definitely.
None of us can speak properly today.
No, it's been one of those, we've taken an absolute battering in the last like 3 or 4 weeks. It's been so busy here. On that note, well, remember Taylor Green. I'm going to bang the drum again. If you know anybody that could give us a hand with the video editing, we're looking for a video editor here at Audiology Associates, somebody that can do some of our editing for us, and possibly doing some of our uploads to the socials as well. If you know of anybody that can do that as a video editor, or know somebody that's just interested in it, we would love to hear from them. If you could drop me an email on admin@audiologyassociates.co.uk. Don't put in the comments for me, guys. I'm going to really struggle to get through all the comments because we just don't really have a lot of time to look at them these days. But if you could email me, that would be absolutely fantastic. I'd love to hear from somebody who could take that editing bit off me. Please, anybody. So yeah, just coming to the end of it now. Managed to get it all out. Just got this little bits of dry kind of skin patches now. With this patient, a lot of them, when they come through, have been reluctant to use oil because historically, if they've used oil, they've got blocked straight away. But now the ear canal's clear, this is what I'll say to people, is that now your ear canal's clear, you can use the oil more effectively, and it is going to stop this from drying out. It might just extend the time in between your appointments.
Yeah.
It just contains the moisture in the canal, really, doesn't it?
Yeah. And it just happens as we age as well. We don't get as much, we don't produce as much oil in the ear canal when we age. So you do end up with these kind of drier canals, very, very dry wax.
I hate these type of ones.
The little bitty ones. Yeah.
Initially it looked like it was a lot softer than what it is as you've gone deeper.
Oh, that's come away quite nice.
Yeah, it is nice.
Bit of a lift there now. Oh.
I think it's the skin. I'm trying to get the lift, but you can see that little bit of skin there, and this is rock solid as well. This piece, it just won't let me lift it, but I can't pull it because that bit's stuck to the bottom, so I'm trying to figure out how I'm going to get that bit off. But it looks like it was attached to that bit of skin.
Yeah.
Oh yeah.
Oh, that looks
nice.
That's a forceps, I reckon.
That's got a nice edge for a set of forceps.
That would be a nice edge for a set of forceps if they don't drop it back down over the suction.
Straight back in it.
I reckon I might that for forceps.
Yeah,
they are.
Sure.
See.
Those ones are so much easier than the ones we used before.
Yeah, that much, because we've got a much they're the same length, weirdly, but just a but just a much thinner jaw, so a little bit easier to get underneath them there. You prefer those forceps, well, the new ones with the thinner jaw.
Yeah, they're just thinner. Yeah, just easier to. Well, that's what I used on my video. I'm not going to mention what's come out because it's no spoilers.
Yes,
that's what I used in that one.
Yeah. Should we keep that one for Christmas?
That's a good one, isn't it?
Should we keep that on for wax vent?
We're going to have to wait a bit longer for that one, unfortunately.
I forgot to ask you about that one, actually.
In a couple of months.
Yeah, Western City, which we kept showing, but it's a good one. Perhaps we'll get what am I doing here? Look at that, it's trying. No, barely. You could see I was kind of trying to get the grip, and I just wouldn't get the grip on it. Because we do have wax vent coming up again this year, towards the end of the year, guys. This is one of the other reasons I'd love to have video editor on board. But yeah, that's coming up at the end of the year as well. So we have started to put some videos aside for that one. There's a few I know me and Taylor have done. Oh yeah, there's the oil going in now. Katie will actually be involved this year as well. So there'll be a few of us. We're going to need more teeny boppers.
Yeah, I was just going to say tiddly boppers. I was going to call them.
Yeah, what's it called? Is it teeny boppers, isn't it?
I think so.
Well, the little things in the headband.
Yeah.
No idea.
Oh.
Bobbly things.
That's what I thought they were called, but no.
I've always known them as
not a bobble.
Teeny boppers, I've always known them as.
Then I would have to look that one up.
Oh, that's it now, isn't it?
Yeah, that's the one. That's what I meant about putting the oil in, just helps you maintain that grip.
Yeah.
Just came away a lot better.
Bit of a tidy up. Nice. Good job.
Thank you. There you go, there it is.
Ooh.
I know, it's quite big. Consider how small that entrance canal was.
Yeah, 3.5 centimetres.
Inch and a half. Oh, this is Katie's.
Oh, this is Katie's.
Clear bit with exactly what that is.
Yeah.
I actually think that this was a patient that come in to have her dome changed, popped it on, and she popped back in 10 minutes later and said, I've lost the dome.
Oh no.
Oh.
Good use of the forceps there though.
There was obviously no other thing they could go in there with.
That's a narrow canal, that one.
Yeah, but I was trying to grip onto the actual bit that grips onto the end of the receiver.
Yeah.
Because there's no way of me getting anything because that's lodged.
It's finding the angle, isn't it? Because sometimes you just got to drop that force. So if you dropped it like that, you'd probably get that. Like, oh, you got it.
Oh, lovely.
Wow.
And then she was like, can I put it back on? And I was like, yeah, I'll give you a new one.
That's you done. Just tailor down.
On to you.
This is me now, is it? Oh, I thought that was... Oh, there's me. I just staring at it. No, I just thought that was the wax behind the door there.
No, you're right. No, you're okay.
No, so this is my patient. This was a regular patient of ours who attends yearly, every time they, just before they go on holidays.
Good advice.
So it's yearly checkup, get your ears checked, before you go away, because if you've got this amount of wax in there, you'll jump in the pool on the first day, you'll just spoil the rest of your holiday because your ears will be blocked up for the rest of the week, or 2 weeks, or 10 days, or however long you go on holidays for, weekend, whatever. So yeah, that one's come away quite nicely. Just going to tidy up some of this dead skin.
Just a little bit.
Yeah. I think it's always the same with this patient. It's always
just
these dry
skin,
yeah. Get the plug out easy enough, and then you've got this layer that just goes the whole length of the ear canal. It's turned away quite easy, to be fair. But not so blocked on this side, but again we're going to clear that up because we don't want to risk any water getting trapped behind. So again, we've got the standard size Zollner tube, which is the larger of our suction tubes. We only use 2 sizes here in our clinic. The other one's fine end, which is we've mentioned already. But we use the fine end if there's a lot of thin dead skin, or if we're really deep in the ear canal. Standard tube generally tends to be does a better job at removing these bigger pieces.
The different sizes of the 2 tubes?
Yeah.
Obviously I know the same power is coming from the actual machine itself.
Yeah.
But is it minimal, does it get not as powerful then on the fine end?
It's just a smaller surface.
Yeah.
On paper, there should be more suction power technically coming through because it's a narrower diameter.
Okay.
But it's on a much smaller surface area.
Got you.
So it doesn't if you think about it, you've got a more powerful suction, but if you move just ever so slightly, you've lost that suction grip.
Right. Okay.
Whereas the wider tube, you're more likely to kind of implant into it a little bit.
Got you.
So you're there 3 centimeters. Sorry, 3 centimeters. Oh, that's a nice easy one.
I know.
Check Katie out.
Took me about
look at that.
Couple of minutes to
The shoes and socks came off and everything.
we see the brain going round.
Well guys, thank you very much for watching that video again today. Hope you enjoyed it as much as we all did voicing it over. Don't forget, if you do want to see all 3 of us again more often on the videos, just let us know in the comment section. We'll try and make that happen for you. But as always guys, take care of yourselves.
Take care of your ears.
And take care of one another.
And the 3 of us will see you again in the next video. Bye everybody.
Ta-ra guys.